Hey, good afternoon, everybody. This is the winter certificate in small ruminants reproduction. I'm so happy to be here. Homero Salinas, the Lincoln University, and with us is Ms. Jennifer Lutz, our staff from NU, and also Dr. Acharya, here Extension State Specialist. Uh, we invite today Stanton Warren, that is a very good known people here in Missouri and some other places. So could you tell us a little bit about you, Stanton, before starting your presentation, please?
You want me to roll right into it after I introduce myself, Homero?
Yes, please.
Okay. My name is Stanton Warren, and I hail from the large city of Ludlow, Missouri, which is in north central Missouri. I grew up in this area, and currently my family and I live here. My wife, Kelly, and three boys are soon to all be out of the house, boys, and we've lived here since they were little. And I work for a company called Reproduction Specialty Group, or RSG, which is based out of Lebanon, Indiana. I've worked for RSG for a couple of years now. Prior to that, I worked for Transova Genetics out of Chillicothe, Missouri, but Transova and RSG are both countrywide companies. And I worked for Transova for 27 years prior to RSG. And so I've I don't consider myself an expert in this. I've just done it a long time. And so I have worked in the industry of reproduction for 30 years almost, and have owned goats for 50 years. So been around it a while. If I don't know the answer to something that you're wondering about, just ask and I'll find somebody to help get the answer. But that's the viewpoint I'm coming from in terms of expert or no expert. So
And
I
I will
will,
just step in and say that Stanton is being very modest.
no,
Um,
no, I will share my screen. If something doesn't work right, give me a shout. And we should be, oh, I've got to start it. Is there a delay, Jennifer? Here we go.
well, coming up
There.
right now. We're up.
Yeah.
We got it. We got it. All right. And there should be a subtitles at the bottom. If anyone has trouble hearing me, I definitely have trouble watching the TV, and I'm definitely a subtitle person. So read there as you can. And so what I'm going to talk about today is how can modern reproductive technologies work in your sheep or goat program. And my my frame is coming to you as if you've never done AI or never done ET or IVF. And so that's kind of where I'm coming from in terms of presenting this information to you. And it's also very difficult for me to present it without presenting it, as you can see, as an RSG representative or employee. And so I'm going to also talk about my own business a little bit at the very end. And so hopefully you'll understand where I'm coming from in terms of how I'm presenting this to you. And I do want to mention too that there is a glossary in the chat. If that gets lost, maybe ask for it again. I think Homero could load that up.
Yes, I will.
Okay. So I'll jump right in here. I've got a lot to cover, and there's a lot of information to talk about, and then I'll kind of bring it all together in my main points towards the end. But small ruminant ARTs, or advanced reproductive technologies, would include laparoscopic artificial insemination. A lot of people may be experienced with what I call transcervical AI or speculum AI. That's something we don't offer, but that is an ART, truly, just not something that's something clients or people would do on their own at home. A MOET, or multiple ovulation embryo transfer, is what you're used to people talking about flushing, and that would be just a surgical flush, can be non-surgical as well. That has been around for quite a few years. In vitro fertilization is fairly new, and probably more so since around 2015-ish for sheep and goats. It has been around since mid 2000s, or say 2005, really well in the cattle industry. It's longer than that, but that's when it really kind of kicked in. And then RSG also does semen collection and freezing, which would also be an ART because it is more detailed or more extensive than just live cover. These are a lot of words. I'm going to read them because I feel like they're important, and their reproduction influences outside of ART procedures. Starting any ART program, anything beyond a natural cover program, requires understanding the process and its potential outcomes. Success depends on many factors from both the female and male, and some are beyond our control. And that's just stating that we do our best to make the best outcome we can, but we are not in control of every aspect of a LAP-AI program, an embryo transfer program, or an IVF program. There are things out of our control, but we do try our best to control them or assist them. ART involves natural biological processes. We're dealing with animals, so results cannot be guaranteed, but careful management improves the chances. And so we're going to come to you with as much advancement and quality of work as we can. You come to us with as much quality of work and management as you can, so that we meet in the middle to produce the best results that we can. I also talk a lot about averages, and this is just kind of a housekeeping thing. There's a few housekeeping things I'm going to talk about, but another thing is averages, and averages in reproduction are shaped by the full spectrum of outcomes, from the very disappointing, meaning no embryos in a flush, to the outstanding, which would be 20 embryos in a flush. And so averages exist because every result across the board is included. That's something to remember when I'm talking about averages. Averages are averages. They aren't if I say you're going to get 5 embryos, that does not mean every time you're going to get 5 embryos. Sometimes you get 0, but sometimes you get 20. So that's something to keep in mind when I'm talking about averages. In everything that we do, everything I'm going to talk about, with a LAP-AI, a flush, a transfer, and a OPU for IVF, we're going to give the animals a light anesthesia. We're going to knock them out. We're going to roll them onto a cradle. As you can see, this goat here is on a cradle. We're going to shear and clip with a surgical blade the hair or the wool off of the front part of in front of her udder. And Homero did want me to mention that I'm going to talk about sheep and goats both. So even though this is a goat, my first picture is a goat, so it's both. And then we will sterilize that area that's clipped off with iodine or alcohol. And that is because it's basically a surgical site. And so that's something that we're going to do in every case of a process that we're doing other than a butt collection. But in the case of anything female oriented, we're going to do that to clean the area that we're going to work on. I'm used to giving presentations where people talk back to me, so I keep wanting to say, does that make sense? Okay, so then in recovery, after the fact, we're going to close up any incisions or punctures that we do with a suture or a staple or super glue. Some cases we don't even super glue them. I mean, there's times when there's basically very little, you can barely see that we've done anything to that animal externally. We are going to spray those incision sites or puncture sites with IU spray. We're going to get a new floor or an LA 200 product of some sort as an antibiotic. Depends on what we're doing, what kind of procedure. And we're going to give that animal that. And then we're also going to give estromate when applicable. Like a flush, we do not want that female to accidentally retain any embryos. Let's say we accidentally leave 6, 7 embryos in her. We do not want her to stay pregnant with those embryos. So we are going to give estromate at that point too. So that's the pre and the post to any process that we do with a female. And then kind of these pictures are to show that we do intubate and what it looks like after we give the anesthesia and do the process. On the left, you can see him probably doing a lap AI procedure on a sheep. And that's my point with this picture, is to show that when you can see that her back legs are tight to that cradle, and she is going to hang there in that situation for the procedure, only for the time that they need her to. And a lap AI will only take 30 seconds. Everything is very quick. When they're flushing her, she's going to be laying down, but at some point she's going to be raised up on that cradle. And donors that we do flushes on and IVF on, you can see on the right side, that's an anesthesia machine where she's going to get oxygen and isoflurane to keep her under. And that's just kind of, I'm just showing that because just so you know. And so something that I'm trying to make sure, especially with a dairy goat or goat people, sometimes those can get kind of, people can get pretty close to their animals. And sometimes with goats, especially, they will scream or bawl when they're on these cradles, and that can get kind of tug at somebody's heart to some degree. And I try to make sure people know that's going to happen. They're fine. It's just how they're reacting to the anesthesia. We also, and I don't think I mentioned this anywhere, we also take them off food and water for 24 hours before the procedure. And so that is to empty the bladder and empty the rumen as much as possible, so that, as you can see with that tilt, the pressure of the rumen is going to fall down on her lungs. And so you want as little pressure as possible during that procedure, even though it's generally fast, to not have that pressure of the rumen, a full rumen, and then you don't want to be puncturing bladders and things like that with the trocars. This is another housekeeping issue that it's kind of rough to be talking about it early on in the conversation, but there are risks with ARTs. And I started right off with the worst one, and that is mortality. There is the chance that your goat or sheep is going to have an adverse reaction to the anesthesia, potentially die from that, or have trouble post-procedure, have like an infection or a complication that causes death. And so sheep and goats, primarily goats, are not good with anesthesia, but we've done thousands and thousands and thousands. So the mortality issue is rare, but it does happen. It's just similar to, you have sheep or you have livestock, you're also going to have dead stock. It doesn't matter whether you're doing an ART or they're kidding or lambing or they're just out on the pasture. So there's chance of death in any of this. There's also a chance of adhesions, whether that's in the reproductive tract or like an abdominal adhesion. That is because we're in there's blood in cases, and you can have trouble with adhesions. And so that doesn't happen very often, but it can happen. They can herniate from the surgery, especially from a flush surgery, that they can have a herniation. We just recommend people involve us and or their local veterinarians, generally their local veterinarians, to help with those situations. You can have an infection where we did the procedure, and then they can also, some animals come off the cradles after a lap AI or a flush procedure, and you don't even act like anything happened. Sheep are that way more so than goats, but sometimes they can take a little bit longer time to recover from the procedure. Just depends on the animal and how they, some people can tolerate pain better than other people, and that's just exactly what happens here too. So it's just a reaction to what happened to them during that procedure. Their reaction doesn't necessarily mean that anybody did anything rough. It's just their reaction to getting put up on a cradle and messed inside. So on into our first topic, or ART, would be laparoscopic artificial insemination. A lot of times we coin this LAI, and just as an easier way to talk through it, we're going to deposit the semen directly in the lumen of the uterine horn. We're going to put semen in each horn, and that lap AI, to those that I mentioned earlier that may be familiar with spec AI or transcervical AI, you know that can be a frustration to get through the cervix, and you're generally going to have a lot of trouble getting through a sheep's cervix. And so we bypass that cervical, needing to get through the cervix. In a lap AI day, you can AI up to 200 head. There's been days of 300. Probably in other countries and even within RSG, there's been way more than that, because the technicians that are trained and experienced can roll through a lot of animals as long as they have a good crew helping them. In a lap AI, we'll use fresh or frozen semen. A fresh ejaculate on a ram or buck can cover around 25 females. And so you can actually jump him more than once. So you could theoretically cover one ram in a day. You could cover 100 ewes or 100 does with his semen for that day. Also, keeping in mind that a big thing of today is shipping fresh semen all over the country, and they not only ship it, but they courier it. And so you can courier semen from a ram in Pennsylvania, and you could fly it to California and fertilize with it the next day. So that's a really cool aspect of the process. And a lot of people now are UPS and FedEx are kind of getting troublesome for shipping. And so a lot of people will fly, or, they can fly on a commercial flight and carry it with them, or also, go through a courier shipping, somebody drive it. The LAI has very minimal punctures. That's the process that I talked, that you may not even glue them or stitch them. I mean, and you may not know that anything really ever happened. So Homero, I've got my first question here.
Okay, let's go to the first question.
It's question 3.
Okay, yeah, I changed it 10 numbers.
Okay. Oh, I can see how people would say
Yeah, get that. Yeah,
B or D.
people got a little bit confused also, because you mentioned both numbers. Yeah,
Yeah, I won't discount anybody.
yeah, yeah. You can give some feedback. Now I will be stopping. Okay, so do you want to give some feedback?
Yes, so the answer was intended to be B25, but as I mentioned, you can jump that ram multiple times or use multiple ejaculates to cover up to 100. I mean, that's all, semi-theoretical numbers, but 25 is kind of the answer, just from one ejaculate can generally cover one. That's how it's sold, is an ejaculate would cover 25, half of an ejaculate would cover, say, 10 to 15. So very good. Now, do I need to X out of that, Homero?
No, go ahead. Just go ahead with the next slide. Yeah.
Okay. Let me make sure I'm on the right.
Yes, you are.
Okay. So the synchronization program, you can see there, Dr. Leo is lap AIing a Nigerian dwarf doe. And so again, just a quick mention, anything, sheep or goat, any breed can be lap AI'd. And so this is kind of I'll also throw in the recipient synchronization protocol. They're very similar, where we insert a seeder, a couple days later. Yeah, that's a little different with sheep and goats. We're going to inject a shot of estromate. I just caught my information. On a goat protocol, we're going to give estromate 2 days before we pull the seeder. And then we're going to remove the seeder and inject a shot of PG600 and introduce some teasers. With lap AI, we're going to lap AI them 2 days after the seeder is pulled. With the recipient, we're going to transfer the embryos into them 8 days after their seeder is removed. And these will vary a little bit between species, between client, between practitioners. everything. These are generally the same drugs, maybe just a little bit different days. And I did want to point out, and I forgot to point out that I'm speaking as an RSG representative, and we do cover the country, but there are plenty of other small ruminant practitioners in the country, veterinarians doing work in different places. So if a person on this call or this meeting needs to get in touch with somebody that's closer to them, I'm more than happy to throw out names. I don't know why I'm frozen here, Romero.
Yeah.
Oh, there we go.
Yeah.
Okay. These are some examples of the drugs that we use for these procedures. And the cedar is in the top left. I don't know. Generally now, everybody's kind of been exposed to cedars. 5 years, 10 years ago, that wouldn't have been the case. And then estramate's down there in the bottom left and PG600 in the top right. We also have used PMSG, which is an ingredient in PG600. And in the last year, estramate and PG600 were both hard to get a hold of. So we were using other products. And then that's just a bag of cedars there in the lower right. Lap AI, a cost and success that I kind of wanted to go over, and I'll buzz through this just to give people an idea of what things cost and what they could expect for results. We do work in Lebanon, Indiana, and Ballinger, Texas as clinic work. And then we do go all over the country at host sites. And that's this $54 per ewe or doe for lap AI is at a host site. And then to get that animal to that point with your synchronization meds, a sheep is $16.33 per ewe and a goat is $12.60 per ewe. Conception rate wise, we're looking at for sheep, for fresh semen, and goats are the same way, an 80% conception rate. And then for frozen semen, a 65 to 70% conception rate with sheep, and with goats, that's in the 50 to 60% range. Again, that's where talking about averages comes in. Those are averages. Now we have question 2, Romero.
Okay, let's go. There you go.
Okay. Looks like everybody's most people have gotten the $55, and that's going to be the accurate answer, B. And I wanted to throw $500 on here, but I didn't. But I think sometimes our natural instinct is to think that things cost more than they really do. And so that I wanted to throw 500 in there just to prove that it doesn't. And so really Lap AI isn't out of the ordinary expensive. It's the expense we'll get into when you're buying semen. Like a sheep semen can run anywhere from $150 to $300. Now that's club lambs, show lambs. That's going to be a little bit different for other things. Like an Aussie white semen is probably more expensive than $300, but maybe a commercial Dorper ram would be cheaper. So and then goat semen can get expensive like that. Dairy goat semen isn't going to be in that range. It's going to be more in your $25 to $50 range. So. Okay, so we'll jump into embryo transfer, or what everybody's used to. There we go. I didn't know I had that not on there. Embryo transfer allows you to increase the genetic impact of superior females. And so more than 1 or 2 babies from those females every year is what this is going to allow you to do. On the left is an embryo, and on the right is just my fun picture of what can happen if you, I'm sure there's pictures like that of goats or ewes with all their babies that came from an embryo transfer program. But that's my cheap way of finding that picture. Just making lots of babies out of your really good females. So a flush on a goat is around an 8 average, and a sheep is around a 6 average. And that's going to vary. These are averages, and so that's going to vary. You might have 5 on a sheep with frozen semen and 12 on a goat with fresh semen. And so that's where I'm kind of throwing in there that variation on results. It's a good way to bank up frozen embryos on elite females as an insurance policy. You know, my sister-in-law wanted to save genetics out of a particular doe line for her daughters if they wanted to come back into the dairy goat world and show does. And so that was a way for her to think about banking up those embryos for later use. A flush, and I didn't really mention this, is surgical. I think I get to this in the next slide, but there's also a non-surgical embryo transfer available. RSG does not offer it, but some practitioners do. And I'm going to talk a little bit later with IVF about the fact that can be less adhesions with IVF, but with ET, RSG has done countless repetitions, countless flushes to make embryo transfer results really good and strong, and the recovery from those flushes and those surgeries be good as well. This is on the right-hand side is a picture of two uterine horns on I don't know if it's a goat or a sheep. They'd be similar. But you open them up with a midline incision close to their belly button, in between their belly button and their umbilical cord area and their udder. You exteriorize the uterus, and then you catheterize it. This is I don't know if you can see my pointer or not. This is a catheter right here, and you gently flush those embryos out of that uterine horn, and then they're collected in this dish. So, there we go. They're putting fluid into the end of this horn to grab all these, to flush out the embryos that are in the top of that horn into this catheter and out into the dish. Then the uterus is put back in the body, and the body wall is surgically closed. And so the recovery on that is a little more extensive than a lap AI. And that's where you've got to be, we try to really ask clients to be really careful with those females post-flush, because that's a recovery from a surgery. We recommend that you don't do any flushing on a ewe or a doe until she's about 150 days post-kidding or lambing. And then we can flush every 45 days for a donor. The protocol for synchronizing and super ovulating, super stimulating a donor is more extensive than the lap AI protocol. We do similar drugs, other than we add faltropin in there, which is a follicle stimulating hormone. And we're given a cedar and an estromate. The FSH is given over about 8 shots. So there's 8 shots of the faltropin. And so your females are going to get upset with you over this, because you're giving them shots throughout the process. And then again, introduce a teaser to encourage them to think they're in season and everything's cool. You're going to AI them on day 16 and bring them back in. And at the same time you're AIing those ewes or does, your recipients are in heat. And then on day 22, you're going to bring the recipients and the donor in to perform the flush, the transfers, or you can freeze embryos at that time. Cost of a sheep flush is $153.48 per embryo. Everything I'm giving you today is in 2025 prices. we will be changing our prices a tick for 2026, but it'll be close. That 153.48 includes a transferred embryo, and it includes that all of our costs, superovulation meds, facility fees, but it does not include semen cost. For a goat and a sheep flush, we require 2 units per donor. A donor with frozen semen is bred twice, so 2 different times during the day. A donor that gets fresh semen is only bred once. Sheep are averaging 6 embryos per flush, with a conception rate of 65 to 70% for the recipients. But then I've got a embryos to fetuses pregnancy rate or conception rate here of 55 to 60%. So you'll put 2 embryos in a recipient, but number one, not every recipient gets pregnant. And number 2, they don't always hold both embryos. Sometimes they'll hold 1 embryo. Goat costs, the charges are the same, but goats make more embryos. And so goat cost is $129.16 per embryo. Again, includes all the services, the meds, the facility fees, but does not include the 2 units of semen. Goats average about 8 and have a similar pregnancy rate as the sheep, 65 to 70% per recip, 55 to 60 per embryo, embryos to fetuses. And I say embryos to fetuses because I don't want to say embryos to babies, because you're going to get babies that don't live. And so then I have to say live babies. So you're going to lose some, which isn't necessarily embryo transfer's fault. So I just talk about fetuses. I feel like I've jumped in here I missed a slide, but we'll keep trucking through here. Let me see here. No, we'll jump into IVF. So IVF is, as I mentioned, is a newer aspect of AR reproduction for small ruminants. Sheep right now are averaging around 9 to 12 oocytes per OPU, or ovum pickup. We also call that an aspiration. And goats average 14 to 20 oocytes per OPU, and we're seeing about a 25 to 50% development rate. A development rate is how many embryos develop, or viable embryos develop, from an oocyte. And oocytes are unfertilized eggs. And so I used to talk 20 to 40, and now I would bump that up to a minimum of 25. And then we've seen some really good improvement in development rates, especially on sheep, to where I would throw that 50% in there as kind of an average. IVF is laparoscopic. I think I've got a better view of the picture on the top right, but IVF is not surgical on the female. It is laparoscopic. And so there are just punctures and no incisions. And so we can actually do them more frequently, perform this procedure on the donors more frequently, and do that up to every 3 weeks. Generally, we're getting about every month just because of scheduling. IVF needs less semen than ET. You can take 1 unit of semen and cover around, say, 6 to 10 donors at a time. So that's kind of jumped down there to utilization of rare or expensive semen. I've seen some really neat results and work done in the dairy goat world, especially with some rare semen. I know there's a buck that had like 5 units of semen in the country, and those 5 units were very carefully utilized in an IVF program over multiple donors. It's less seasonally dependent than say embryo transfer, because the donors really don't have to be cycling. And then we see that sheep IVF results, and this is kind of a new discovery for us, is that sheep IVF results tend to really improve later fall through the winter. And so we're seeing some amazing results with sheep IVF this winter. And you can do them quicker post lambing or kidding, because they don't have to be cycling. Ovaries are constantly turning over follicles all year long, whether they're pregnant or open, or there's movement on those ovaries. This is just some pictures. And so this is a lap OPU in progress on a sheep. This is where Dr. Tad is looking in to visually, he's seeing the ovary. This over here has a little gripper on it where they're getting the ovary in the right position for him to then come in here with his right hand. There's a needle attached to that, and this is a vacuum, similar to a vacuum on a milking machine. And this vacuum is pulling the oocytes into this tube and into media. And so that's just a picture of that process externally. These are oocytes here. And then this is just showing the lab. We've got to be set up. I tell people kind of like a surgery suite or a surgery room in a vet's clinic. That's kind of how clean things need to be for IVF. Just from a standpoint of not having trouble with contaminations and bacteria and such. All right, question number 1, Homero.
Okay, there you go.
I think the transcript is spelled Homero 6 different ways.
Can we read the question for those who may not be able to see the question?
What is the proper terminology for the donor procedure involved in small ruminant IVF? A is ovum pickup, B is aspiration, C is flush, D is both A and B, and E is none of the above. I was thinking about the same thing, Jennifer. Probably needed to read it. And how am I doing on time?
You're right. Okay, yeah.
I've got an hour and a half left, right?
No way. It's against the supper. Okay. Now
Okay, so
you have several answers there.
yep, and I'll kind of talk through those a little bit. The answer would be D, A, and B. So an OPU or an aspiration. A lot of people want to call it a flush, and that's because we're so used to saying flushing in the world of repro. And that flush is physically a flush of the embryos out of the uterus, whether that's a cow, a sheep, or a goat. And so it's physically flushing, just like you think of flushing or flushing an eye with saline solution. That's different than IVF because with IVF, we're physically aspirating those eggs right off of the ovary with a needle, not guided, that's cattle, but a needle that's connected to a vacuum. And so that's the difference and so if you tell me, hey, I want to flush my sheep, I'm going to start you on a program that's for flushing. But if you talk to me about IVF, it's going to be a whole different program. So that's why I kind of try to make a point of this, the terminology in this case. As I mentioned, the LAP-OPU is very non-traumatic on the animal. You can see these little punctures. Those are from the laparoscope punctures, the trocars, and that's her just all, glued up and sprayed with algae spray. So my demonstration here is just how less invasive or how non-invasive that procedure is to the female. And we know from cattle that those ovaries, they'll aspirate cattle every 2 weeks, just bam, 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 over and over. And those ovaries are even though you're poking the ovary with a needle, you're poking the follicle with a needle, those ovaries are very strong in recovery. And so they'll recover very quickly. And I don't know the physiology behind that, but they recover quickly and you can do that procedure on them very rapidly and multiple times. So just something I want to point out about IVF. IVF is more expensive because you've got a lab involved. So when you have a lab involved and all of that, you've got extra people doing work. And so when you're doing ET or flushing, the work is handled in that sheep or goat's uterus. She's doing the work. But when you're doing IVF, you've got however many people in a lab fertilizing, maturing, stripping, cleaning, sorting. You've got them doing all of that in the lab. So we've got a little Aussie white IVF baby there on the right. That was one of the first IVF Aussie whites, I think, for RSG and for a guy that works for RSG, Doug Edge. But IVF embryos for sheep are $351.01 per embryo. And you can tell I like exact numbers. And that's the IVF services, the meds to synchronize them, the facility fees, but it does not include semen cost. And I didn't put how many we would have to have here, because if you're doing one ewe and you have a ewe or a ram you want to use, you're just going to use 1 unit of semen. But if you have 5 ewes, you're still only going to use 1 unit of semen. Sheep right now are averaging 4 embryos per OPU, and that has dramatically increased in the past few years. We're actually averaging almost 2.5 embryos per procedure out of those in the recipients. And so that's a pretty cool number. Here recently, these aren't averages, these are situations, but we averaged 7 embryos on a set of about 20 sheep. And we've hit some 5 embryo days pretty regularly too. So we've seen some really good numbers on sheep IVF. Conception rates are a little lower than with flushing. As I mentioned, flushing has been, I'm not going to say perfected, but we've done it enough and really know how to roll with that system to where we're averaging good numbers and making good preg rates. But IVF is just a tick under that. So 55 to 65% for conception rate on recips, with 45 to 50% of those being babies, coming out as baby or fetuses. And so, and I say fetuses again, because that's in utero. That's what we're counting in ultrasounds. And so with this, say you get 50%, you're looking at $700 per baby that's born for the cost of the IVF. That does not include the cost of the recip. Goats are $277.82 per embryo. Same situation as far as the cost, but they make more oocytes, they make more embryos. And so you're going to have about a 5 or 6 embryo average on a goat, and with similar conception rates as sheep. And these actually, I've got a picture of later in my presentation. These were does, Nigerian does, probably all national champions. From a guy in Kentucky. Got a little baby out of this one in the picture that I have coming up. Question 4, Homero.
Okay, there we go.
Question is, in an IVF program, 1 unit of frozen semen can typically cover how many donors' oocytes?
We have mixed answers.
And I understand it's hard to get in my brain about what I was trying to ask.
To remember all the stuff that you are sharing.
Yeah.
Yeah, but this goes later on the feedback that you give.
Yep. So my intended answer was 6 to 10 donors. Generally speaking, we're gonna have 1 or 2 donors, and that unit's going to cover them. But my point was, how many could it cover? And that is 6 to 10. And that's limited by the time span that we get those donors aspirated in. But I can see everybody's reasoning for different answers. I won't flunk you today. Okay. And then, sorry, Homero.
No, go ahead. Yeah.
Okay. It's funny to say this word. I couldn't figure out how to say it differently, but the transfers of the embryos, whether they're ET or IVF, are the end product of what we're doing in terms of ET or IVF. And that's they're gonna laparoscopically look in that female and see if she ovulated and if she made a corpus luteum, similar to cattle. Cattle, they feel for a corpus luteum on the ovaries. And then they're going to, if she's good and going to receive an embryo, they will exteriorize her uterine horn, the side that has the corpus luteum. And they're just going to bring out a little bit of that uterine horn and put the embryo. That's what Tad's doing right there, is expelling that embryo into the tip of the uterine horn. And then he's going to close her up, sometimes with a staple, sometimes with a little suture. That's a tiny, tiny incision on that female. But that process is the same, whether it's ET, IVF, fresh embryo, frozen embryo, anything. Okay, now on to a part of the ARTs that I'm not as familiar with. Obviously, I've been around semen and collections and freezing. It's just not been the aspect that I've been involved in. I've been on the female side of life for 30 years. But it's definitely a very interesting aspect of what we do. Very just interesting to me, and I hope to learn more and more about it. The buck on the left here, the Oberhasli buck with his tongue out, I sent him out to RSG, to Lebanon of mine, to get him collected. So I've had some very up close and personal experience with this program with RSG. And so collecting and freezing semen allows you to increase your breeding flexibility and efficiency. You can send your genetics all over the country or all over the world, but you can also bring in other genetics from all over the country and all over the world. And so that's a very interesting aspect of the semen side of things. And then also just that, let's say you freeze a ram in the fall, you're going to have his semen in the fall. No, you freeze it in the winter, say, you're going to have it in the fall to use to breed. You're going to have those genetics. And so that's another aspect of it, is not only knowing that you have him and that you have what you want when you want it, but you can also preserve those valuable genetics if he dies or whatever happens, if he goes sterile, anything like that. And then just biosecurity. You can introduce animals into your herd, genetics into your herd or flock, that you don't have to worry whether he has CAE or CL, because you're not going to introduce that. You're not going to introduce that through the semen. And so that's a very interesting aspect, and it goes the other way. Somebody can get your genetics without worrying about your diseases. This is the new sire center on the right. They have, I think they can house 80 rams or bucks in that upstairs. You can kind of see this below is not a pit, but just underneath. And these are all the rams and bucks are up here. And that's new within the last year. And so they can do a lot of export work and just general collection and freezing in that new sire center. And these are the prices here. I can send anybody prices that they're interested in, whether it's ET, LAI, or IVF or semen. But the point here is it's about $750 a unit to freeze up a ram or a buck, and with a minimum of 50 units. And then we also store semen and embryos at RSG. Now to the stuff that's interesting, to how this all applies to all of us. And I reached out to Jennifer earlier today and said, hey, what are the average prices of kids, or what were the average prices in 2025? And she said kids were $387 a pound, and sheep slaughter lambs were $290 a pound in 2025. And so I want you to keep that in mind for what I'm talking about, because in this case, to me, I'm talking more to a commercial producer, I feel. And maybe I'm wrong, but I want to talk to the commercial producer, because ARTs are historically have the mindset of the purebred breeder or the breeding stock person. And so I think they can apply to anyone. And that's why I've introduced the expenses of them. And so more pounds to market means more money, and genetics drive that growth. So if you can work in your own flock or your own herd and make your females produce more milk, you're going to have heavier lambs and heavier kids. So that genetically they're going to do better and make every pound you get is $2.90 for a lamb. Or faster growing offspring obviously means more pounds, and certain animals, certain genetics are going to grow better than other genetics. Highlight of smart, efficient management and uniform offspring. So when you're going to do LAI, we could come to your place and AI every single female on your place at one time. Now, you're going to be busy come lambing time or kidding time, but you're going to have a very uniform group of babies at that, at weaning to sell to whatever to market you sell to. So you're going to have a consistent size and age when you wean. You're going to have it, even that uniform group is more eye-catching and financially advantageous at the sale barn or whatever sale you're doing. And also, I feel like that concentrated lambing and kidding window simplifies your management. Just like we went out this weekend and gave all the does CD&T. Well, you can do that on a yearly basis, but it's also kind of a pre-kidding shot. And so most of our does are going to kid in March because they're all embryo transfer does. And so it just simplifies your management system. And then improving your herd or flock quality. So think about your herd or your flock and that you have top genetics that do better in your management system and in your management environment. You can take those females and the top females and make more of them and use your poorer quality females as recipients. And then over time, your flock or your herd is going to be a better quality, higher producing flock because you're concentrating on those females or males that thrive in your environment. So you can replicate them because you're going to see that there's certain does or there's certain ewes in your herd that they do better. Their babies are always the biggest, and that their daughters' babies are the biggest, and et cetera. And so that's my mindset in thinking about maximizing those high-end females in your flock or your herd. And maximize your investment. ARTs multiply the best genetics over more animals, a bigger group than natural breeding alone. So you can select a buck or a ram that can produce more pounds per year. You can go find that ram that's going to do that. And that added income from more pounds of lamb from that high-end buck will justify you paying more money for that buck initially. And so I know that's throwing a lot of stuff at you at once, but that's just my thought has always been that what I've been involved in, AI, ET, IVF, doesn't have to be for somebody that goes out and wants to produce a $30,000 buck. Yes, that's what we do, but it can also be for somebody that just wants to make more money by selling more pounds of product, and however you can institute it into your program. Again, it's very difficult. I keep wanting to say, any questions? But this is where I like the feedback and talking about something like this, because I can mention this here, but there's so many options and so many ideas that a person can come up with in relation to your own program. And so that's the hope that I have in this conversation, is to generate that in your mind, I guess. Then just I switched the whole look of this because I'm switching to my own program. We have, since 2022, my family and I switched over from having breeding stock to selling or being in the recipient business. And that was something Jennifer helped me with a lot, was the financial aspect of that and looking at what we could do financially. And this program is what we've kind of moved from selling pregnancies to actually just selling live kids. And so people will put their embryos in our recipients, in our does. We'll kid them out, and then we'll sell them a weaned kid for $800, today's market, or these would be weaned kids, or almost weaned kids, and then this would be a little bottle baby, IVF baby from one of those does I showed you earlier. But then that kid is $750. I met the guy that got her right before this meeting, and so that's a very fresh picture. And our does are a dairy base. I really like the dairy does. I'm used to them, and the aspect of them that I like. They're CAE negative and CL free, and at first we were selling pregnancies, and I was sending a lot of really nice does off the farm that were clean does, and we've kind of changed that program to just be live kids live kids rather than pregnancies. And my point isn't to sell this product to you. It's not to sell my program. Mainly it's to say, what could you do with your program that's different than normal? And how could people out there take your program that you're doing work for every day and change it a little bit to make more money? There I go. We're down to questions.
Stanton, I do have a little bit of a prompt for you. As he mentioned, Stanton and I have worked together for the last few years periodically. And he shared a story with me last year, I believe, about some of his own does that he synced during what's typically an estrus, a seasonal anestrus. Will you share that with the group? Are you willing to share that story with the group and your results?
Was that with the melatonin?
Yeah, I believe so. Yes.
We did a set of dry yearlings, and that was the group that I sent them out of here, and that's when I was like, I'm not sending any more out, because we brought a Kiko buck in, and if this isn't the story, Jennifer, tell me, because I don't have a great memory, but it was our first set of Kiko cross does. There were about 13, I think, dry yearlings in that group that we put frozen embryos in for somebody else. I think 11 of those stuck, and then I sent 11 of those does out of here to a person to kid out, which was fine for him. They were just a really nice set of does that I then had lost custody of, so to speak. But we had done that work was in June, so that would be off season. And we did do, and that's something that we are working harder at educating clients on, is the melatonin implants, which are little pellets that go in the base of the ear, and they release melatonin, which is what the animals are releasing naturally in their normal breeding season because of the short daylight. And so I believe that the melatonin helped the preg rate on that particular set of does. And so it's something that you could use melatonin in a set of ewes or does that were that you were live covering in May. You could do that and help yourself without doing any ARTs. So was that kind of what you're thinking, Jennifer?
It was, yes.
Okay.
All right. So here's some other questions. How often can you lap AI or ET a doe before adhesions become an issue?
So you're not going to get a bunch of adhesions with lap AI. You obviously could. You can cause adhesions with anything, anytime you do anything with an animal, but you're probably not going to get too much incidence of adhesions with lap AI. With a flush, you could get adhesions from the first time you flush her. That's not necessarily going to happen, but it is a possibility. And so the more times you aspirate her, or the more times you flush her, the more times you're going to run the risk of causing a problem. And adhesions aren't the only problem, but it is something that can happen. And so I think you're probably going to see more adhesions with goats than sheep with a flush. And it's probably to do with their bodies being different and how they act after a flush. And we try to keep people from letting goats climb up on gates after they're flushed, and because of the incisions and the everything in their system. And so just the different things like that. I hope I answered the question, but you could have trouble with one repetition, but
Gotcha.
there's no magic number. You could flush her 10 times and never have adhesions. So
Gotcha. And there's a lot of questions about how many times donor does can be flushed or can be lap AI'd, those type of questions. Is there any kind of number out there that you guys stick with, or is it really dose specific?
I would say dose specific, but I think that the thought process would be, obviously there's times when you have an investment in a female that you need as much as you can get out of her as quickly as possible, as many times as possible. And so that's something that those things factor in. So probably with a flush, if you're going every 45 days to 60 days, you're not going to do her over and over and over. You're probably going to let her kid, maybe do her in June, July, and then again in September, October, something like that. And then get her pregnant and let her have her babies again. And so ideally, an animal, and any female, needs to have babies. And so you flush her 1, 2, 3 times, and then get her pregnant, let her have babies, go again. And so that's the cool part about a goat or a sheep. It's 5 months instead of like a cow, which is 9 months. You can turn them back over and do them again. Now with IVF, you can turn them more rapidly. You can go every 3 weeks. And potentially, I don't want to say it too loud, but potentially have less adhesion problems and do them longer and more rapidly.
Gotcha. Thank you. How long is both fresh and frozen semen viable for?
The frozen semen and frozen embryos, I thought I put it in somewhere, but maybe I didn't. As long as they're kept properly in nitrogen, they're frozen indefinitely. And so that's however long you want them to be. Fresh semen, I'm sure there's times when people have gone longer, but you want to use that semen within 24 hours of being out of the buck or the ram. And so you're going to let's say you're collecting somebody in Pennsylvania and flying it to California. So you're going to collect him later in the day on a Monday, fly him out, and then use that semen first thing Tuesday. And so I'm sure there's been times when he was collected Monday morning and it's been used Tuesday afternoon and it's been successful. But just talking about what should happen, that's how I would kind of roll with it.
All right. I have a couple questions specific to RSG. Do you know how far in advance they typically book ram or buck for collection? And the other question is, does RSG perform embryo transfers at host sites or only at their own facilities?
So the last question is easy. Host sites, we flush anywhere. And so that's an easy question. IVF, we are mainly aspirating in clinics at Ballinger and Lebanon, but we have started going on farm. But just keep in mind with any of that stuff, we have to justify the numbers to come on farm. So we have to have the numbers to justify coming on farm. And so that has to be efficient and economical for everybody. Now, the first question as far as getting on to schedule the ram or buck collection, that's going to be dependent on the time of year and how full they are. But, if you're calling in December and January, you might wait. But if you're calling in September, October, you might get them in the next day. It just depends. They have more room now that they have the new sire center. So that's definitely a plus. And then there's the location in Ballinger, Texas. They can't take as many there, but they can take bucks and rams down there.
Okay. And how much more time do we have, Homero?
I think we are over time. Yeah.
Okay.
Yeah. I think the people, maybe you want to make a summary to send to state on those questions so we can send um, his presentation, so you can give us your presentation, and over there is the email state on, so feel free to ask him any questions. You want to start with this program, so it's so great. So thank you so much, Stephen. Was so great your presentation. I think we are closing this certificate. I mean, we have two more webinars the next 2 Mondays. But it's so great having you here. Everybody is doing very good comments about you. Yeah.
Well, thank you.
Yeah. And so we see you next Monday. We are going to have, the surviving from the babies, from the pregnancy to the kidding or to the lambing from Virginia Tech. And second talk 2 weeks from now from Jennifer Lutz to make numbers about reproduction. So that will be so good. So thank you so much and have a good day and good week. Thank you, everybody.
Thank you.